just a little bit behind, just trying to catch up. So just give me 30 seconds. I just want to get it's on my phone just because sometimes it doesn't show me if anyone's watching live or if there's any questions come up, so I try not to catch myself out, so I have my phone going as well. Just a bit unnerving because I watched that and it's a few seconds behind the laptop. So welcome to this week's live. So today I thought I would talk about what is perimenopause and am I in perimenopause, as in are you rather than am I. So I'm just going to track down my notes. I'm not going to find the one but I might use this. Right, so what is menopause? Or what are we talking about when we talk about sort of perimenopause and menopause? It's when perimenopause is the time that our hormones start to, the estrogen starts to decline, and the progesterone, the estrogen fluctuates, the progesterone declines and the testosterone starts declining, and that's where we get all the symptoms from. So after we've gone through puberty, we go into sort of just giving this some treats. He's left out again. Yeah. Okay, dig. You're not listening to me. So yeah, once you've gone through puberty, you start your sort of normal cycle. So I call that pre-menopause, PRE, and then you stay in that, and then the hormones at some point will start fluctuating, and that's when we start getting the symptoms. And it's when we get the symptoms that it's perimenopause. I know generally we talk about menopause symptoms as menopause, but if it's actually perimenopause is when it all starts. So perimenopause starts, and it can be about 8 to 10 years before you go through menopause. So what is menopause? Menopause is one day. So it's the one day that you've not had a period for 12 consecutive months. Up until that, you are perimenopausal. And I've just got out my champion training notebook, and on average, if you sort of go through perimenopause at a sort of a natural age rather than early menopause, you'll have on average 400 periods. Now, during perimenopause, one major sign is a change in your cycle. It may shorten, it may lengthen. You may be getting them, your periods may be a lot longer, they may be a lot shorter, they may be heavier, they may be lighter. Mine definitely became more frequent. They were like every 2 weeks, and they became, rather than 5 days, they were well over a week, and they became really, really heavy. So that is, if you're thinking you might be in perimenopause, looking at your cycle is a really good idea of what's going on. And it's also watching your cycle. If issues with your cycle, it can also pick up other health conditions as well. So if there's any change, and if you've got daughters and they're young and there's a change in your cycle, it's worth getting it checked out that there's nothing underlying going on. So menopause will be experienced by women, people that are non-binary or gender questioning or transgender as well. So if you were basically born with a uterus, you've got menopause at the end. It can happen for months or years before menopause, and like I say, it's, it can averages 3 to 8 years, but you can have symptoms for between 2 and 15 years, and you can have, some people have them even longer than that. I've spoken to ladies that have still got symptoms in their 70s. So the average age for menopause, so that's the menopause day, is 51. So the normal age range for menopause is between 55 and 55. So and under 45, between 40 and 44 is known as early menopause. Under 40, it's premature ovarian insufficiency, or POI, and that can happen basically at any point after you've gone through puberty. So like I say, any change in your cycle, if you're definitely under 40, go and speak to the GP and get, checked out and find out what's going on, because that's not normal. I think, if you're the body, if you're anorexia can cause a stop in cycles. If you're starving, it can cause a stop in cycles. So it's a really good pointer of something that's going on in your general health. So menopause, you can have natural menopause, or you can have a surgical menopause. That is when you have your uterus removed, and when you have a hysterectomy, they will either take the ovaries or they will leave the ovaries. If they take the ovaries, so you have a nephrectomy as well, bilateral, if you take both, so that's bilateral nephrectomy, you will go into a surgical menopause immediately. If they just take the uterus, it could be about 5 years before you start having symptoms. It may happen before, but they think the average is about 5 years. Chemotherapy and radiotherapy treatments can lead to menopause symptoms. Medical treatments for endometriosis and premenstrual symptoms can bring on a medical menopause. And some autoimmune conditions can cause menopause to be triggered early. So like I said, menopause is the symptoms. I'm just going to keep calling it menopause, even though I'm talking about perimenopause, because that is basically what people are wanting to know. They'll say, am I in menopause? When it's actually perimenopause, you'll probably be wanting to know. So it's looking for different symptoms. That's the best way of checking if you think you are perimenopausal. The symptoms you're going to have will be potentially a mixture of cognitive, psychological, and physical. No two women will go through the same mixture of symptoms. No two women will have the same intensity, and no two women will experience the same thing through perimenopause and menopause. So it's really hard to say, oh well, I was fine, and so you'll be okay. Some people will glide through menopause and not realise anything's happened. Other people will struggle to function on a daily basis, and some people are sort of in the midst. And I was quite lucky. Mine were more annoying and sort of more mild. I didn't have any severe symptoms. Some people, the cognitive ones, brain fog. My trainer, she said she thought she had dementia because she couldn't remember anything. She'd be walking into meetings, couldn't remember what she was going to say. So you get the brain fog. You can get a loss of concentration. You lose your self-esteem, your self-confidence. I definitely did that, and like I said, and it can affect sort of your memory. It's thought that an ethnicity and lifestyle and genetics also play a role in how your menopause is. Physical symptoms you can get, like palpitations, dizziness, dry mucous membranes, joint pain, allergies, sensitivities that you've never had before, digestive issues, flushes, sleep issues, your hot flushes, your cold flushes, tingling mouth, itchy mouth, changes in body odor, increased acne, loss of hair, restless leg, tinnitus, burnt dental issues, bladder infections, prolapses, vaginal atrophy, weakened pelvic floor, osteoporosis, changes in your menstrual cycle, I've already mentioned, increased migraines, headaches, changes in your nail, weight gain. They're just a few of them. And then we've got the emotional, the psychological ones as well, so the anxiety, the depression, low mood swings, loss of libido. So there's 34 symptoms that are recognised as menopause, although depending on what you read, there could be between 100 and 200. So the majority, the main symptoms that people complain about, this was some research that was done, I think there was 2,000 women that responded. The majority of them had difficulty sleeping. That's the progesterone, because progesterone plays a part in sleep. Problems with concentration and memory, 75%. Night sweats, hot flushes, 72%. Anxiety, depression. Then the joint stiffness. Heavy periods was half of them. And they got palpitations, UTIs and headaches, and 1% had no symptoms whatsoever. So, listening skills, I don't really want listening skills. So, what... So basically, I'm not going to go into the hormones today. So basically, I mean, the main hormones that are playing a part are estrogen, progesterone, and testosterone. Testosterone is what is commonly known as the male sex hormone. We have testosterone, like men have estrogen. So the estrogen is the female sex hormone. Normally, it sort of stimulates the growth of the development of the egg and the release of the egg, and then the progesterone looks after the uterus and lines the womb and expels the lining if there's no pregnancy. But testosterone and estrogen have receptors all over the body, so it's not just related to the uterus. Estrogen plays a part in anti-inflammatory. It plays a part in my brain fog now. In mood, cognition. It plays a part in immunity. It's a word I can get out. It plays a part in cardiac health, bone health, muscle health, digestion, the skin, and the same with testosterone. Again, they've got receptors all over the body. So you can imagine if your levels are a lot less than they were, there are going to be issues all over. That's why we get such a weird and wonderful mixture of symptoms, and that, I think, is why we don't pick up what's going on, because of the mixture of symptoms. They're not just sort of period related. It's just not just pain. It's not just heavy bleeding. It's not just cramping. It's the other things. It's the joint pain, frozen shoulders, increasing migraines, dry skin. It's nothing. And you don't link them together because there's no obvious link. Which is why, as women, I certainly didn't know what perimenopause was. I'd heard of hot flushes, and I had a few days of really bad hot flushes, and then they disappeared, and I thought that was me over and done with. And then my period stopped for a couple of months, and I was, jumping through hoops. I thought that was all over and done with. I didn't realise everything else that was involved in it. It was only attending Lauren's awareness session that I realised that everything I'd felt had been perimenopause. So I'd started with hay fever, I'd had frozen shoulders, I'd had mild anxiety, depression, I'd lost my confidence, I was about to thinking about packing my job in, etc, etc. Joint pains and digestive issues and things like that, affected being warm at night, sleep and stuff. But like I say, that was when I realised what was going on, because to me, I just didn't understand why I was feeling like I did and why nothing would seem to be working. So it's just a mixture. So perimenopause is that mixture, and like I say, it's really hard to say yes, you are in perimenopause, or no, you're not. The other challenge is that the medical doctors are not routinely trained, which is why when you go to a GP, you could well struggle to get support or get answers. So if you're going to go to the GP or your doctor because you think you're perimenopause, if you're struggling and you just don't know what to do, before you go, track your symptoms. Keep a record of them for a couple of weeks. Look at how often you're getting them. What is the intensity? How often are you having a hot flush? Is it every day? Is it once a week? When are they occurring? And just keep a list of the symptoms that you're getting. Over the age of 45 in the UK, you can be diagnosed with perimenopause on symptoms alone. You do not need blood tests. And the NICE guidelines have recently been changed. I'm just going to try and get those up and then read them to you. So NICE is the National Institute for Clinical Excellence, and this is what the doctors should be all doctors should be working from to give the best care. So under identifying perimenopause and menopause, identify the following without lab tests in otherwise healthy women, trans men, non-binary people, registered female at birth who are over 45 and have menopause associated symptoms. Perimenopause if they have vasomotor symptoms such as hot flushes. Identify without lab tests. So if you're having hot flushes, night sweats, and a change in your menstrual cycle and they've started recently. If you've not had a period for 12 months and you're not on the pill. If you've had a hysterectomy based on the combinations of symptoms such as hot flushes. They need to take into account the difficulty to identify menopause in people who are taking hormonal treatments, for example, medication for managing heavy bleeding, because you can't really tell. Different ethnic minorities will have some lifelong conditions that may mean they get menopause at a younger age. So do not use the following laboratory tests or imaging to identify menopause in people over 45. Don't use an FSH blood test to identify menopause if you're on the combined pill, because if you're on the pill, you're artificially managing your hormone levels. They only consider using the FSH levels to confirm menopause in people 40 to 45 with menopause associated symptoms, including a change in their cycle. Under 40 whom menopause is suspected. So that is those with primary ovarian insufficiency. And you may find, depending on the training that your understanding your GP has, is if you're under 45, they could well turn around and go, you are too young to be menopausal. So it's really important that you stand your ground, do your research before you go, and like I say, go with a list of symptoms. Right, so this is all about managing it now. So that's from the NICE guidelines. And again, through the Women's Health Concern, which is part of the British Menopause Society, the NICE menopause guidance, first published in November 2015, states perimenopause should be diagnosed on symptoms alone without blood tests in healthy women over the age of 45. This is because blood tests can be unreliable when estrogen levels are fluctuating, sometimes significantly. So when you have a blood test, the levels of whatever they're looking at is only at the time that they take the blood. It's not what it was like 2 hours before. It's not going to be what it's like 6 hours later or next week. It's what it was at the time the blood is taken, and especially if you're looking at hormone levels with your estrogen up and down, that can fluctuate up and down during the day. It's not something that goes sort of gradually. It can be very, very significant. Again, they're saying essentially any result will only be a snapshot in time, which can be misleading, which is why having 2 blood tests within 6 weeks will give you a better idea of what's going on. For those under 45, blood testing may be appropriate, again if the symptoms are clearly related to menopause, blood tests may not be needed. Under the age of 40, women who have not had a period for 4 months or longer, or have symptoms which suggest estrogen deficiency, need at least 2 blood tests to be taken 4 to 6 weeks apart. So like I say, the important thing is that you track your symptoms, write them down, write them on a paper, get an app. I have got a symptom tracker I will share with you that you can use as well, and I was going to upgrade it, and then I checked it. Just because I had this great idea that I could do this, that's another way. And when I looked at it, it was already done. So it's you can print off the pages for different months. It's got, I think, 7 days across 7 days. And you can put in the intensity and the day, so if it happens on a Monday or whatever. So I've got that I'm really happy to share with you, so you can go with it to the GP and go, look, these are my symptoms. And I've spoken to women that have gone to GP doctors and started reeling off the symptoms, and I said, right, you don't need to stay anymore, that's it. And if you think you're in perimenopause and your symptoms are indicating that, and you want stand your ground. If you're getting poo, go and speak to another doctor. See if there's one who's been trained in menopause or has an interest in women's health. But like I say, do your research. The Women's Health Concern in the UK has got loads of information. So if you're thinking about going on HRT, they've got loads of information, leaflets on HRT in there. And if you need the link for that, let me know. I can share that with you as well. So when you go, you can have an open discussion with the GP and go, look, I've looked into this. I feel I would like to try HRT, and I want to try ABC, and can I try it with the patch or the cream or the tablet or whatever, depending on what you feel is the best, because your care should be individualised for you. It should not be what everybody else before you had, and it's your right to ask for what you want. Thing with HRT is it's not an instant fix. It is not paracetamol. It is not take it today and feel better tomorrow. It can take 3 months. It can also need to be adjusted. The route might need to be changed. So it may be that you start off on oral HRT and that doesn't work. So they may put you on patches, or you may have to change from the patches to the cream, or the cream to the gel, or the gel to the tablets, or whatever. So it's not quick. Can take 3 months, and they can have, like I say, may have to change the route. They may also have to increase your dose if it's not effective. So don't walk into the GP and think HRT is the answer to all my dreams, because like I say, it can take a while. It's not guaranteed to get you back to where you were. Some women feel better coming off it. Some women think it's the best thing since sliced bread. Like I say, it's a very individual thing, and it's your choice what you want to do. You don't have to take HRT if you don't want to. I never went on it. I was umming and ahhing about it. There are pros and cons with it. You can get side effects, but it's that discussion that you need to have with your GP. I'm not trained in advising on GP. I can give you a basic understanding, but I can't advise on doses or prescriptions or anything like that, because that is way out of my scope of practice. I'm not trained in it, so I can't do that. If you've got a question about HRT, you need to speak to the prescriber, or you need to also talk to a pharmacist, because they're the ones that know the medication the best. Plus, they can access your medical history, which if you spoke to someone like me, I can't do that. Even if I could advise on HRT, I don't have access to your medical history. Some people are not able to take HRT if they've had certain cancers. It may be risk averse for them to take it. So it's working out, to manage your symptoms, it's working out what is best for you. Like everything, it's your choice, it's your body. If you want to give HRT a go, I will stand behind you and support your choice. I'm not going to tell you don't do this and don't do that. It's down to your choice. What I would say is, if you're struggling with your symptoms, go and have a discussion with the GP, talk through your options, and make an informed decision. If you don't want HRT, there are other prescribed medications that can be offered to manage some of the symptoms. For example, the hot flushes, or the psychological symptoms. Let's see what NICE says about so finding out what's psychological symptoms. There is cognitive behavioural therapy specially formulated for menopause. That was a really weird noise, I don't know where that came from. But there's not a huge amount of therapists out there that do the CBT for menopause, so maybe just accessing normal CBT, that's been shown to help in some women, but it's finding what works for you. I know NICE are recommending CBT is offered if needed, as well as the HRT. I know when they were reviewing the guidelines last year, there was a whole hoo-ha because somebody said that NICE were going to say that you just have the first line of treatment is CBT. But that wasn't actually the case. So let me just find. If we go to a training on the guideline update, I'll just see if there's anything in there that I can let you know. HRT. So, let's all about something in here. And I probably won't be able to find it. Nice guy. Oh, here it is. Right, NICE guidelines. So, NICE guidelines are advising an individualised care. Like I said, it's the choice is the treatment option for you is just specially for you. It's not what Sally had next door but one, and not what necessarily Margaret's going to have, who's going to walk in after you. And they're trying to encourage doctors to start talking about menopause earlier with women, so you know what's coming, which I think is well overdue. They accept that symptoms can be mild to severe, they can last a long time or short time. Ethnic groups may experience menopause at different ages, but all interventions and changes should be offered. They should be discussing how long you can be on HRT for, and if you're on HRT, what the if you stop the HRT, what are the risks and benefits of coming off it, and will your symptoms start again? Other should be offered psychological support if you're between 40 and 44, if you're distressed by the diagnosis of menopause. I suppose if you're still hoping to have a baby and then you find you're in menopause. HRT for sort of hot flushes and the night sweats, HRT should be given at the lowest effective dose, and consider, like I say, CBT, menopause CBT, as well as the HRT. Or if people are contraindicated to HRT or they don't want it, you shouldn't be being offered routinely antidepressants to manage your low mood, unless it is a clinical depression and not just hormonal based depression, sort of hormonal based mood swings. If it's clinically based, if it's clinical depression, they should be following the NICE guidelines on treating clinical depression. Again, sleep with vasomotor symptoms, so night sweats, hot flushes in the night. Again, menopause CBT along with HRT is recommended. A little bit of minimal evidence around CBT for insomnia. There's no recommendation that HRT should be stopped at all. I've heard some women say that the GPs have told them they have to stop taking it, but there's no recommendation it should be stopped. That is your choice whether you keep on it or not. History of HRT is unlikely to affect life expectancy. Okay. HRT should not be offered as a prevention for dementia, because people might think. Okay. Right. Okay, so that's that one. So, like I say, if you think you are perimenopausal, track your symptoms. No matter the age, just go with as much. When you go to see the GP, go with as much evidence as you can do. For testosterone, so normal HRT is estrogen, and if you've got a uterus, or potentially if you've not got a uterus but you had endometriosis, they may well give you progesterone. If you've no uterus and no endometriosis, it's likely you'll just get the estrogen. Testosterone is available. It's not currently licensed in the UK for women, and you would need blood tests doing before you got testosterone, and you're more likely to need to go to a specialist because it's being given off license. And that at the moment there's not a lot of research on the effect of, you can get testosterone for loss of libido, but there's minimal evidence at the moment for the cognitive impact that it has, even though people are reporting they're feeling much better. So, right, okay. So, like I say, it's important that estrogen does muscle and bone health, so we need to be looking after our bones. So make sure you're getting enough calcium, you're getting your vitamin D, doing impact exercise. That can help stimulate bone growth as well. It can affect your loss of estrogen can impact your gut health, so making sure you're eating sort of the probiotics and stuff like that. One of the trainings I did recommended at least 2.5 hours per week of moderate activity. 3 weight bearing sessions for bone health and core to help with balance and core, and cardiovascular disease is prevented with the help of exercise. A minimum of 5 to 10 days is beneficial for mental health. So managing sort of socially, there's an increase in divorce, social anxiety, workplace issues, loss of confidence and stuff like that. So it's trying to find people to talk to, access therapies. You've got an EAP, or if you've got therapy or stuff like that, and getting support and things like that. This is where the social interactions, maybe where the coaching comes in, or joining the challenge and things like that. Be aware that you don't start social self-prescribing, so over drinking alcohol and things like that because you're trying to get yourself better. Alcohol is a depressant, so we take it, we feel good, but we feel later we don't feel so good, so you want more to make you feel good. It's just a vicious cycle. Increased alcohol will can cause an increase in weight. It can also increase your risk of breast cancer. And as you get older, the tolerance of alcohol changes in the body. So promoting, managing your sort of, try and look after yourself as best you can. Estrogen plays a role in mood regulation and mood regulation and stuff and things like that. So, and it can affect sort of sleep and stuff like that. And if your sleep's not good, you're going to feel that's going to affect your mood as well. So it's just a vicious cycle of trying to do as much as you can with the lifestyle, and that is what I promote with all the programs. And the challenge, it's all around lifestyle, because if you're managing your lifestyle, if you're doing the best you can with looking after yourself, you'll feel better. You're in control. You're giving your body what it needs to function at the best it can. So you are you feel better. And if you're if you're well hydrated, if you're eating well, if you're getting the rest that you need, if you're getting the exercise you need, if you're getting the help you need, if you're getting rid of the rubbish, no matter whether it's physical rubbish or the rubbish in that room that you don't go into, or that cupboard, that is lessening your stress, and lessening your stress will help you feel better. Like I said, there are alternative medications if you don't want HRT, for a variety, that will help with a variety of problems. Looking and remembering whilst you're looking after what you're taking in your body, making sure you're looking after your pelvic floor as well, because that's when you don't want your prolapses, and sort of that's when you get the urinary incontinence and things like that. So if you remember, we had Sandra in that did a recording for us about the importance of pelvic floor health. So if you've got any questions around that, drop me a message. I can put you in contact with Sandra. Sandra's fantastic. She's just released her pessary to help with prolapses that's getting great reviews, and she's really pleased with it. So if you're having like what she calls oops moments, it's something you don't tend to talk about, you don't mention it, keep it to yourself. But if it's not normal, you shouldn't be doing that. You shouldn't be sort of hiding it away and getting help. So if you want anything, any help around there, there is Sandra, who's the physio. And if you do my 6-month program, the Thrive Through Menopause program, you get an hour's session with her as part of your program to look at pelvic floor health, to make sure it's the best you can be, etc, etc. So yes, so I think that is it. So menopause, perimenopause can happen at any age. Just as a summary, usually it happens after you're 45, but it can happen at any age. So if you're under 45 and there's a change in your periods and your cycle, it is worth getting checked out. Before you go to the GP, no matter what age, record your symptoms. Keep a record of them. Take them with you. Speak to the GP and go, I think I am perimenopausal. Here are the symptoms I have been having. Have a think about what you want, because if you're going to what are you going to the GP for? Are you just going to find out? Do you want to just find out if you are? Or is it because the symptoms you are having, you are struggling with? And if it's because you're struggling with it and you want some prescribed management of them, what do you want? Do you want HRT, or do you want the non-HRT option? And if you want HRT, do you want topical, or do you want patches? Have a think about the best way it will work for your life. The patches you put on every few days, the creams you put on every day, but then you have to stand around and let them dry. Or do you just want the tablets? I mean, personally, if I went down that road, I would avoid tablets, because I hate taking tablets, because I forget to take them. So keep a track of your symptoms. Go prepared. Take somebody with you, because if you're emotional, you may well forget what you want to say, or you'll get overwhelmed, and if you get feeling they'll get brushed off, you'll just clam up. So take somebody with you. Try and get a double appointment if you can. Find a doctor who's got an interest in women's health, who's got the time, who has a vague idea if they know what they're talking about. If you're not happy with what you get from the first GP, go and see if you can speak to another one. Maybe even talk to the practice nurse. They may well have had training. If you want, besides having the symptom tracker, I've also got a tips on talking to your doctor, so I'm happy to share those if anybody wants them. So yeah, I mean, and then once you've got your answer, and if that's what you want, if you want an answer, it's deciding on what you know, like I say, the treatment that you want. Do you want to go down the HRT route, or do you want to go down the life, just go on lifestyle and looking after yourself? And that is where my expertise comes in, is the lifestyle side. Even if you're on HRT, you still need to do the lifestyle, because like I say, it's not a guarantee. And if you're on blood pressure medication or you're diabetic, you still need to be put in doing the lifestyle work as well. So menopause is no different to any other condition. If you're on HRT, make sure you're having a regular review to make sure the dose is correct and it's still working for you, because it may need changing and things like that. So it's really important you have regular reviews. But like I say, lifestyle, managing stress and lifestyle. So drinking, plenty of keeping yourself well hydrated, having a really good sleep routine, eating well, look for trigger foods. If you're having some symptoms, migraines or digestive issues or hot flushes, look at your diet. Your gut microbes will have changed. It may be that you need to start taking things out or changing things around. And also, as we get older, we don't have as much energy, so that's where the weight gain comes on, because we just eat the same things that we did, the same amount that we did when we were 30. So cutting back on intake, cutting back on carbohydrates as well, because we don't want to build up the high sugar levels, become insulin resistant and diabetic, or type 2 diabetic. So cutting back on the carbohydrates, the refined carbohydrates. So if you're going to eat bread and rice and pasta, go for the brown, because that is slower to release than normal sort of white rice, and which has been refined and everything else. So I hope that was of help today. I didn't write a script, so I will have waffled and rambled, but I will share the symptom tracker tomorrow. And if you're thinking about going to speak to your GP and you want the tips on talking to your doctor, let me know, I can share that as well. But if you've got any questions, please do reach out. I'm here to help you. I'm really happy to give you, point you in the direction of signposting, or I will answer the questions if I can. If I don't know, I may have to go away and find some answers. But I will always get back to you. So please do reach out. I want to be able to help you, support you. I don't want you worrying at home with a question. Don't be afraid to ask. The chances are, if you're thinking it, someone else will be thinking about it. And there's no question that's a stupid question. And like I say, before I went to my first awareness session, I didn't know anything. And it's only been through doing the awareness training and doing my champion training and doing the coach training, and then the other trainings I've done with that, I've done courses through the International Menopause Society, New Some Health Menopause Society. I did one a few days ago through the Menopause Education and Research Fund. I go to regular webinars, lunchtime webinars and things like that. So if it's menopause related, I usually try and get to it if I'm able to learn as much as I can, so I can best support you. So that is it. Like I say, I'd love some feedback if you found it helpful or not, and also ideas for future lives. Next week is the 20th. Not sure what I'm doing that day, or if I will do one that day. Maybe I might just cancel that one because it's Dad's funeral on Tuesday and I don't know what headspace I will be in. But if I feel okay, I might jump on and just do a quick chat. But if you've got any areas you want me to talk about, please let me know, because I want to make sure I'm giving you the information that you need, you want, and the answers that answers to questions. So let me know if you watched. Stick a hello or replay or watching. And if you've any questions, do add them in the comments and I will get back to you. And have a great evening.